I think that the data that you have, and this is where I think it's important to have a GI colleague provide perspective as to what the data on TIF is, because it's been, sometimes you'll see people talk about complications that are from, TIF has gone from endoluminal fundoplication to sort of TIF 1.0 to TIF 2.0. And a lot of perhaps what you hear about in terms of negativity occur from the ELF or the 1.0, which account for probably less than 5% of the total procedures that have ever been done. And of the over 100,000 procedures that have probably been done now, the vast majority are of this, newer approach. And, the data, particularly in those patients in which, that hernia issue was addressed, I think it's very important not to, like any technology, it's got to be used appropriately. But when you appropriately reduce the hernia and do the TIF procedure, you'll see normalization of pH in between, overall 40 to 60%. But if you take a look at the group that really was aggressive about correcting the hiatal hernia, it's essentially equivalent to what you see with the surgical fundoplication. 70 to 85% of people will completely come off their medications. And there's durability data now at 8 and 10 years suggesting that patients are satisfied with their results. Like any procedure, there may be some decay and need for medications over a long period of time, but that's true of surgical fundoplication as well. But I think that, and if you take a look at quality of life, it's interesting that the TIF procedure actually is higher than surgical fundoplication, and a primary reason is that while I think it assesses the issue of the reflux, it doesn't have as many side effects, so you don't get the negative to go with the positive gain, leading to an overall increased satisfaction.